Hey, Nakia, how are you today?
I am doing fabulous, Wendy. How are you today, my dear?
I'm good. I'm good. We're back for day two
Yes. All right.
to talk about the CT Nurse Wellness Summit, the first
Yes, the
CT
first.
Nurse
Let's be
Wellness
clear.
Summit. Yeah. So yesterday, I think we kind of dug into what it is. We talked about the need for it in Connecticut. Um, and today, I wanted to kind of talk about turnover. I'm not sure why that kept coming to me, but
Hmm.
nurse turnover.
Mm.
There's still a nursing shortage. However, I don't know if I believe that.
Hmm.
I think nurses are just displaced, so to speak,
Hmm.
um, in terms of they're not at the bedside. They're not at the bedside. So I don't
Hmm.
know. I think there's a lot of turnover, but the
Hmm.
shortage. I just think there's less nurses at the bedside choosing not to be at the bedside.
Yeah, I
What are your thoughts on
I
that?
get yeah, I get where you're going with that. I agree. I think for a long time, I mean, when people think of nursing, they think of nursing associated with a acute care setting, so
Yeah.
associated with a hospital setting. And I think as we've seen with, I mean, so much advancements that has happened within the profession, nurses are choosing other options. I mean, which I think is absolutely fabulous. I mean, I think we need to be able to expand beyond that, which means that we need to rethink how some of these, you know, kind of status quo positioning has been throughout these like years. So to your point, I think nurses, yeah, I think they are choosing some other options outside of just the acute care setting, which,
Yeah.
we need to evolve beyond that is my thoughts and own personal bias, I guess.
Yeah. No, I totally get what you're saying too, is we need to evolve. And a lot of nursing students aren't even aware that there are other
Mm,
options because, I'm not sure. I'm sure for you, same thing. But in school,
yeah.
we just did acute, subacute. We didn't see a lot of these different options in terms of
Mm,
nursing entrepreneur. A lot of nurses are running their own business, wellness, aesthetics, private practice, doing a whole bunch of different things. However, it leaves a gap in care. As
mm,
let's say our state comes with focusing on Connecticut, aging, people are living longer, they're sicker, so we do need nurses at the bedside. But how do we fill the void in
mm,
terms of getting people interested in nursing? So going back to nursing school, what that looks like. And I think that's important for us because, with the CT Nurse Wellness Summit that is October 4th at
mhm,
Quinnipiac University in
mhm.
Hampton, Connecticut.
Actually, North
North
Haven, because remember, we're in North Haven.
North
Yes.
Haven, yes, North Haven, Connecticut. We will have student nurses there,
Mm,
and I think equipping student nurses with the tools that they need for not only clinical, but when they're out there in the field is going to be really important in terms of nurse retention. So I would love to get your take on what are your thoughts on wellness, student nurses, and these educational institutions such as School of Nursing. Like, what are we doing or not doing?
yeah. Yeah. Oh, so many thoughts on that. That's such a loaded one there, Wendy. But I will say to your point, going back to even my, beginnings of my nursing school journey, the focus was very heavily on just, working. It was preparing you to work in a, acute care setting, so in a hospital setting, with all of the clinical rotation focus. I mean, that's obviously it's a lot of that's on your NCLEX exam, so that is clearly what the focus is on. But I will say, as we continue to like shift, I feel like we're seeing such a shift, with all the advanced practice nurses. Obviously, Wendy, you could speak a lot on in terms of that. But I think as we're seeing all of those shifts, what it's calling for is like, I think as healthcare also needs to shift. So less of the focus on so much of the kind of post acute, so after stuff is already happening. So what are we doing more in the preventive end? Because I
Um,
mean, it's more of, And I think that will be helpful in terms of as we talk about drawing nurses to the profession. Because if you are like, I don't want to just deal with the after effects, but how do I help people in maintaining or even starting and living a healthy life? What does that look like in terms of their own wellness? And I think it comes back to the nurse's well-being. So if I feel like if I'm role modeling behavior, I'm living a good life, I want to be able to provide that to patients as well too. So, and that's a lot of, what we'll be talking about and really shining a light on is how nurses are allowed to really just live well. So I will say to that, I think the focus really needs to shift. We have to open up, like, yes, we still obviously we're still going to always need hospitals, but how do we again just shift the focus from less of the reactionary stuff that we see a lot in healthcare to more of the, how are we proactive? What are we really talking about in the prevention space when it comes to care? Of how do we help people just live well? What it means to really eat whole foods. That's a whole other discussion about when we talk about the foods and all that. But yeah.
Yeah, so that just brought up a whole different topic in my mind. My mind is like all over the place. Because, what I always tell people, I go around, I talk a lot about stress management, emotional intelligence, and healthcare professionals. And something I always say is that, stress and learning to not even manage stress, but just work under stress starts in nursing school. Nursing school was probably undergrad was one of the most stressful times of my entire life. And I've had a long life, right? Already. Those 4 years were tough, right?
Yeah. I will definitely agree on that. It was
no
hard.
one talked about wellness. No one talked about stress management, right? And then we're pumped out into the profession, which is just as stressful. And again, no one's talking about it. No one's doing anything about it. So I agree, like that being proactive of, where we're growing from. Like, I think of like planting a seed, like nursing school is like, where the seed in nursing schools really don't get me to like that on plant, but like the dirt in the water. But in order for us to grow,
absolutely, I totally get where you're going with this,
right? Yeah.
So
it speaks to that being proactive versus reactive.
Yeah. And then really it's to your point of, of the growth analogy of the nurturing piece of it. It's like, and really in that preparing nurses, for this, whatever their path may be, whether it's designed to work in an acute care setting, if that's what their passion lies, or that's what they see for themselves, or doing something else that we talked about, both of us are in the entrepreneurial lane. Like that was never something that was talked about in nursing school. I didn't even think that was an option, so it's like now navigating these waters, it's certainly challenging when you don't have that, so figuring out as you kind of like are maneuvering along. But I think to your point in talking about, whether it's dealing with the acute care world, after nursing school, like still needing strategies and tools for how to manage and deal with life, and what is the best place to be able to kind of nurture those skills is in like a school setting where things are a bit more controlled, and you really have, the support and the resources to really kind of walk you through and, role play some of those scenarios and not sugarcoat it because it's,
Yeah, but I also think, in terms of nurses being groomed and looking at different aspects of nursing, I don't even think, in some, I'm going to say in some institutions that nursing students have even the capacity to even tap into those different entities because of the stress, right? Because of the already burnout, right, that they're experiencing, in undergrad. We're talking about new nurses. We're talking about fueling the profession and filling those gaps that, this is another part of nursing, but you can't even hear me. You can't even, really effectively inquire or explore if, you are stressing and you're not well. So what's going to be at this conference or this summit that's going to really help that or speak to that?
Yeah, I mean, it really is an opportunity for nurses to one, just decompress. Like there's so much that, I think as human beings that, we're all in this human school and trying to figure out life on an everyday basis, let alone you add in like the work environment. So really a place to come to release all of that, but also to really gather and gain some tools and strategies for just everyday life, like coming to a place where there's going to be community. So you're feeling supported. There isn't this sense of like, oh my God, I got to do the next thing, or oh my God, there's so much stuff that I need to know or figure out or to do. But it's just like, no, like understanding that this is all for you. It's for, right. Yes, you can use some of the skills and tools for work life, but it's also for life too. And deciding if like, hey, there's some really great things that I took away from, maybe it was a Qigong class, or maybe it was yoga, or that sound healing. It really kind of put me in like a state where I'm like, this is something that I want to tap into outside of this. So I think it's opening up just other possibilities and opportunities to be able to explore, what else is available there to you. I'm big on like having almost like, tools in your toolbox, like depending on, what you need for a moment, because every day may be different. So what you can tap into, again, that just allows you to live well and to be well.
Yeah, no, I love that. And how did you get into the wellness space?
Yeah. So, girl, that's a whole other story. And I'll give you the summed up version. So this was certainly not on my path, or I guess like on my bucket list or like bingo card. Like it was none of those things that I had really seen for myself, but it was during COVID. I would say COVID happened. I wasn't working in the clinical setting. I had already left bedside, but I was pulled back into the clinical realm, not because I was like, well, you know what, it's a pandemic, let me dust off these ICU skills and get back into bedside care. But I think as with many nurses, it was that feeling of obligation, like, this is something that I have to do. So, I did what many of us do. I just, dust my shoulders off and, push down whatever those feelings of angst and worry that I may have been feeling at the time. And I just pushed down to push through. And what I realized during the push down to push through is that I ran out of capacity to continue to push down. And I reached like a breaking point. And that breaking point was like, I don't know what this is, but I know that I need to take a step back and really take care of myself. So really experiencing what that burnout felt like. And when you have so many other, competing priorities, as we like to say. So also a wife, a mother, then you have, I have to go to work because I got to support the family. So all of those things brewing at the time, but recognizing that I needed to take that break. And it was the most difficult, but it was the best decision I could have made in my life. And during that time away, I ended up, doing some more internal work, focusing on me. I ended up enrolling in the Institute for Integrative Nutrition, where I focused. It was really about how do I get myself and finding myself. And through that, I learned so much about what it really means to be whole and well and continuing on this path. And I found so much joy from it that I'm like, I feel like I'm a fabulous person, but I recognize that I'm not unique in this. So in really wanting to reach out to other fellow nurses and those in healthcare to say, hey, I get you, I've experienced this. So that was how the business launched, and working with nurses and other healthcare professionals, and mainly women too, on how to really, what it means to really, take care of yourself through self-care. And self-care is not just the massages and manicures, but it's what you do to allow yourself to live well, whatever that looks like for you. So so that was like the start of it. And it's now been this passion that has spawned into a business that, is continuing to grow and be supported. So
I love that. That led us to the CT Nurse Wellness, right?
Yes.
Right. Yeah. No, that's amazing. That's awesome. And I didn't know that about you. I didn't know that you went back to clinical practice during the pandemic.
Yeah, I did.
Same story for me. That's how I went back in clinical practice. I was home working as a scientist at the time. And my story is a little different. So I experienced the stress on the other end, because I felt the obligation. I felt the pull of family, virus out there killing people, but I still had this. And now in retrospect, I always say my purpose, like my gut was speaking to me. I was wrestling with my purpose of wanting to go out there and serve. And the thing is really the stress is what was impeding me from following my purpose, following my gut. So the way I talk about stress, you actually remove that lid in order to be your best, to do your best, and to give your best, right? To really lean into your purpose.
Mm,
And when you are stressed, you kind of lose that ability, which I see a lot in nursing, right? Like we're all
absolutely.
anxious to get there, and we, have the heart of gold, and we want to
Mm,
care, but as we get burned out and stressed, that fades away a little bit.
yeah.
But moving through that, and really standing on purpose and making the decision that I'm going to go back and honor, that feeling I had in my gut was like
Yeah.
the best thing for me. Was like
Yeah.
it opened up a
Oh, I
whole,
love that. Yeah.
yeah. So living well is definitely part of that. You have to manage, the stress of just life, because like we said, life be life. And I just like that I can say that.
I
My
know.
second time saying it, life be lifing, right?
It does. It does. And like my one word that I love, and I use it a lot with my family too, is just like capacity, is recognizing like we all have this thing because we feel like, and you were speaking to it too, is just that, in that lid when we're really at our capacity. But because we have this, this drive, especially as nurses, and that may be a whole other discussion of what's been ingrained in us sometimes, of just this, we have to put everybody else before ourselves. And if we don't do that, then it's selfish. So we got to
Yeah.
undo a lot of that stuff. But the capacity piece is recognizing when, I don't have that at this moment. Like, I need a minute. I need to be able to refill me, take a step back, and it's okay. Like that was a really big thing for me, is being able to say like to my kids and my family, I need a minute. Like,
Yeah.
love you. Like in order for me to be my best self and I'm not snapping and doing all the things, I need to
Yes.
take a minute to just step back from myself. And it's like, it's interesting how like now they get it when I'm saying like,
Yeah.
mom just needs a minute. Like I need some time to myself. They're like, oh, okay.
Yeah.
Like it used to be like, well, what do you mean you need it? Like now it's like, oh, okay. Like, no,
Right.
and
No.
then I'll hear the other one say, if somebody comes knocking on, like, whether like, oh, your mom, she just needs a minute. So
Yeah.
just give her a minute. So I'm like, all right, like
It's working.
they're getting it. Yeah, it's
Yeah.
working. So, you could train others too to understand what it is that you need. So
I
it's
love
all
that.
good.
I love
Yeah.
No, that's awesome. Yeah. So all of you watching, this is just a start. We'll be back tomorrow again to do this.
Mhm.
But in the meantime, you can go to summit.ctnursewellness.com and get your ticket for the first CT Nurse Wellness Summit. We are partnering with the Connecticut Nurses Society Association, CNA, on this effort. So it is a statewide movement. We are calling it, and we are also going to be, bringing some other nursing organizations into the fold so we can really expand this effort. But go to summit.ctnursewellness.com and get your ticket, and be here tomorrow because we may have a giveaway. Maybe,
Yes.
right?
You have
But
to know to find out.
yes,
So, yeah.
yes. Tune in tomorrow, same time,
Mm.
same place. We'll be here, and we'll see you then.
Yes, sounds good. I want to add one other thing. If you
Yeah.
are, again, if you want to sponsor a nurse, if you're not a nurse and you're watching and you also want to sponsor a nurse, you can also reach out to us at hello@ctnursewellness.com. And we'd be
Okay.
happy to take those inquiries as well too. So exciting.
All right. Sounds good. I'm going to put that on the screen for people just so they could. I thought I was.
Oh, there it is. Yeah.
There we go.
Yeah, all righty. It's there.
Hello@ctnursewellness.com. Just to say hello. If you have any questions, any thoughts, any comments, yeah.
Or if you want to volunteer your time there as well too, we're also
Yeah.
open to that as well. So certainly email us about just some time, like, hey, I want to be a part of this experience in any way that I can to be able to help support. Yeah, we love support.
One other thing, people are reaching out about being a vendor. We will have vendor information definitely out to you. But if you are interested in being a vendor and you're watching this, you can also email us and we'll send you the link to be a vendor. All right.
Yes.
So we'll see you tomorrow, 1:30. Again, there may be a giveaway or two. So you want to tune in.
All righty. See you guys tomorrow.
Bye-bye.
Bye-bye.